At the Africa Health Agenda International Conference 2025, leaders and experts gathered to discuss innovative solutions to Africa's pressing healthcare challenges. CNBC Africa engaged with key figures driving change in the healthcare sector. In this special segment, we begin with Dr. Gitahi, CEO of Amref Health Africa, to explore the theme connected for change and its impact on strengthening healthcare systems across the continent. Let's listen in.
Health is actually a public good for everybody. Good health is like a safe airspace. It is shared by everybody. So whereas countries' national health systems are important for their people, having good health systems and safe citizens in every country is a safety for the next country and the next and the next. So it's actually connected, because you've seen during COVID-19, recently the Mpox, diseases don't have visas, they don't have passports. So they go across, they don't know borders, they just spread as they wish. And therefore, when you say connected for change, we're saying that we are connected in multiple ways. In one way, the countries are connected, that no one health system should actually ignore the other. And the continent and the world is as weak as its weakest link. So we are connected in ensuring we have a good health system across the continent, and we work together in all areas, including disease surveillance, but not limited to that, including local manufacturing, including sharing data, but also connected for change, because health doesn't exist in a vacuum. Healthy populations, healthy individuals depend on healthy animals and healthy environment. There's also the issue, therefore, of climate change, One Health, ensuring that we are connected between all the planetary needs, environment, that's plant health, animal health, and human health. And finally, connected for change means that no single sector can assure health systems. The health sector must work with the private sector, must work with the environment sector, must work with veterinary sector, must work with all sectors. So we are connected in multiple dimensions, as I've indicated. And I think by bringing those dimensions together, we have 56 countries represented here. We have 181 different partners. Then we can discuss and say, what is our common agenda for Africa? That's why it's called the Africa Health Agenda. So we believe, and out of the conversations we know, we are forming partnerships across each other. We are breaking boundaries. So the post-conference improvement will be noticeable, because we've seen those networks formed here and those partnerships already formed.
Those are excellent points. AHAIC is known for driving actionable change. How do you ensure that the discussions and commitments made during this conference are going to be turned into real and lasting improvements in the healthcare on the African continent?
So thank you very much. I think the most important way to actually ensure there is follow-up and accountability is one, to institutionalize the recommendations. So we have WHO here, we have Africa CDC, and those institutions alongside government, when we pick up policy changes that need to be done, then we ensure that they are located somewhere. Right now we are discussing, for example, what we popularly call the Lusaka Agenda. And the Lusaka Agenda is about ensuring that any domestic resources in a country like in Rwanda are supported by international resources, what we call international aid, private sector money, and all those things. But when they meet in a country, they must work together. They can't work fragmented. They can't work together. They have to work together. That's the Lusaka Agenda, where people have committed. And we have meetings here around seeing how countries have implemented this one plan, one budget, one strategy at a country level, so that when the funds come to the country, they are supporting a common health system. And we've seen the risk of not doing that. We've seen, for example, that USAID has been funding countries for over 20 years, for a very long time. And when USAID pulled out of many programs, countries that hadn't approached the funding as actually a collaborative, respectful partnership and ensure that the money was supporting a common budget, a common plan, are now struggling to integrate the services that were actually left unattended back to the health system. So those conversations of the Lusaka Agenda, for example, are anchored in Africa CDC. They came out of these kind of conversations, but they are now anchored in Africa CDC through an Africa Union mechanism. So this is how we follow up. Number two is we have civil society. Civil society is an accountability partner for government. And governments are here, civil society is here. So when we have these meetings and we agree, then civil society goes back and ensures that they're holding others accountable. But finally is that some of the recommendations here are going to be taken forward to countries for discussion with their parliaments, but also to other global convenings like UN General Assembly, World Health Assembly, so that they are actually propagated. And for us as Amref, our role is to enable this interconnectedness to happen.
Building on this discussion, we also spoke with Dr. Magda Robalo, President and co-founder of the Institute for Global Health and Development, to gain insights on how Africa can integrate local health priorities with global frameworks and ensure lasting healthcare transformation.
Africa Health Agenda International Conference of this year, it has been special in the sense that we at the global health landscape, we are going through very unique challenges with abrupt disruptions in terms of financial support to African countries for their priority health concerns, and therefore coming together in this particular moment is so critical, and the way the conference is shaped, bringing together governments, civil society, private sector, communities, implementers, young people, women, it gives us the opportunity really to reflect on how do we move forward together, how do we strategize to position Africa in a better foot in the global health landscape, and how, most importantly, we reach the people who need the services.
The Institute focuses on global health and development. How do you see the integration of local health priorities with global health frameworks? And what role does Africa play in shaping the global health strategies in general?
I think Africa can do more. Africa can be setting the agenda at the global level, given the power that we have as a continent, the resources we have, the capabilities we have. But unfortunately, due to several challenges, which has to do with our historical background and the arresting development that is caused by that, we are not yet at our best in terms of influencing the global health space, but we are working towards that. I think Africa, if we get better connected, if we get less fragmented, our voice will be louder, better structured, we will have more influence in the global health stage, and we are working towards reaching that level, because indeed with the knowledge that can be generated, is generated already in this continent, the power of our youthful population, really indeed we can set the agenda at the global stage.
With different solutions which were provided in the conference, including the innovation strategies, how do you think these stakeholders, what steps do you think stakeholders can take to make sure these innovation solutions can be brought to life, can be brought to ground and have an impact?
Already several innovations are being implemented in many countries, and actually participants brought those experiences to share with others so that they can go back and also experiment in their own countries. I think the innovations in terms of health technology, be it telemedicine, be it AI, the power of genomics nowadays are making a difference in many of our countries, in some more than others, but increasingly information is being shared, knowledge is being shared, and innovation in health technology particularly is little by little improving access to healthcare services in our countries, including people at the last mile, those in very remote and rural areas who otherwise would have not been reached. Fortunately, today with the power of technology, it is possible to even realize complex health interventions in very remote areas.
Amazing. Looking at the different initiatives, which ones do you think are the most promising to bring solutions to the challenges that the health care sector in Africa is facing right now, they are promising enough to say that in 10 years this will be a life-changing step taken?
I think the innovations that we need to look at will not be maybe technology, the technology I just spoke about. It will have to be related to reforms that we need to make in our health systems so that the power and the potential of health technologies can reach the maximum number possible. We still have hindrances within the system that constitute a challenge for these innovations to reach the maximum number of people. We still have health workers not adequately remunerated, not adequately supported. We need to regulate our systems for these technologies to be used at the best benefit and with the good intent. Technology can be sometimes used for malicious intent. We need regulatory frameworks that will protect people from malicious intent. We need to make sure that our health workers, our health facilities have clean water, they have electricity so that they can benefit from innovation. Otherwise, it becomes difficult for you. If you don't have internet in a health facility, it is difficult to take advantage of a technology that requires you to be connected. So, yes, the health technology innovation will change the way we deliver care, make healthcare, quality healthcare more accessible, but we need to do certain things in order to amplify that potential. And most importantly also, we need to make sure that we advance with equity. We really need to make sure that the most vulnerable, the most disadvantaged are reached, and it is not just those in higher socioeconomic status benefit the most. So these to me are the most important factors that we need to pay attention to in the next 10 years, 20 years to make the power of innovation in health to be really effective and afford people the quality of healthcare they deserve.
From policy commitments to groundbreaking innovations, AHAIC 2025 showcased the momentum toward a stronger, more resilient healthcare system in Africa. As leaders work toward actionable solutions, partnerships and long-term strategies remain crucial in shaping the future of healthcare on the continent. Stay tuned for more programs on CNBC Africa.